Well, thank you for having me and thank you for coming out today. This is our topic today, choosing the appropriate level of care for your loved one. And I want you to know that coming from my point of view, I most recently have gone through this. I have been in this situation for about a year of going through different levels of care for my mom and have had to find the appropriate level of care for her. So having been in this industry for a number of years, I thought it would be easy because I've done this. This is what I do. It's what I do every day. It's not easy. When it's someone you love, it's a whole different perspective on what you're looking for. So I hope you know that what I'm saying and what I'm talking about truly does come from my heart, because I do understand the struggle. I understand how hard it is to make such a big decision, and know that regardless of what your decision is, you do have folks at McLean that you can always call and talk to us about your decision or help you guide you along this path. The most important thing, I think, and it's why you're here, is that this is a decision you recognize you don't want to make in a crisis. You certainly don't want to be under the gun when it's time to find a placement for somebody you love. You want to have done your research. You want to know about the facility that you're choosing. And this is the first step, is by doing your research. The difference with McLean is that we do offer different levels of care. The independent living, we have an apartment building, we have some cottages, the Robinson assisted living, the Atwater memory care assisted living, and the Abernathy enhanced assisted living, which is a new level of care that we have that provides a few more touches for folks that need assisted living. Our post-acute care is what you hear about, usually referred to as rehab, short-term rehab, but that's a post-surgical rehabilitation unit. And we also have our long-term care. Long-term care is for folks that are skilled nursing. So those are for folks that do need total care, that will be living there. Now we're going to talk about payment, because a lot of folks have that insurance question. What pays for what? So when it comes down to insurance and you're looking at an assisted living level of care, so you're looking at the apartments, you're looking at cottages, you're looking at assisted living, that's private pay. Post-acute care, this is where it gets a little crazy, and this is where I'm here to help you out, and know that when it comes down to a referral to our post-acute system, I'll help you through that insurance piece. If you are a Medicare participant and if you're in the hospital for 3 overnights, and this is where there's a lot of confusion, people will say, I need 3 days in the hospital. You need 3 nights in the hospital. So technically you need 4 days in order for your Medicare to cover your first 20 days in a skilled nursing facility. On day 21 is where your coinsurance or your supplemental insurance comes into play, and there's a big difference here. Generally, your Medicare supplement will pay days 21 through 100. A coinsurance may not. So when you have your card, call that number on the back and find out what you have, because a lot of folks are surprised sometimes when they do come in and I explain to them you're covered 100% through day 30. Sometimes there's a little shock because they think they get 100 days. That's not automatic. There are 100 days available to you through your insurance, but you also have to meet specific goals. You have to be participating in therapy, making goals in therapy, showing improvement, a steady improvement. We have lots and lots of folks on managed care. A lot of folks are picking up managed care policies now. You're going to have Connecticut, Aetna, Blue Cross, Anthem, Cigna, and a managed care. It does tend to cost a bit less, but their days that they do cover in skilled nursing are less. So check that. So if you have a Connecticut policy, Connecticut VIP, and HMO, sometimes all they cover in skilled nursing is a maximum of 60 days. And it's something they don't always tell you, or you may not think to ask about when you buy that policy. So find out what mom or dad has on their policy for skilled nursing coverage. And it's important that you wait for those words, skilled nursing coverage. And that's for your post-acute care. A lot of long-term care policies out there. Folks come in and they tell me they do have long-term care. Every policy is written differently. We always ask for a copy of the policy. We can help guide you along that process and let you know what exactly is covered. And for some of our folks that have been with us for a while, they're currently maybe in a Medicaid spend down, and we also help you along that process too. And that's when your assets reach a certain point. You can't have more than $1,600, and then you are eligible for Medicaid. So how do I choose? First thing I do for anything when I'm looking is I ask my friends, what have you heard? What do you know? Who says what? This is one instance where you really want to ask a lot of people. Ask around. What's the reputation? What have you heard about the place? Medicare.gov it's a great site because you can compare, nursing home compare, you can compare different facilities, and what you'll find on that website is the actual survey. Every skilled nursing facility is required to go through a Department of Health survey once a year, and it's a very intense week or so where the state does come in and it's a relicensure survey, so they do look at everything in the building. Dietary, housekeeping, nursing, every corner of a building, and you're graded on how you do. So you can actually see the survey and see the results for any facility on that website. Touring obviously is the best way. And I have a few tips for touring. You might have been told, and I do tell folks this sometimes, is to walk in. Don't make an appointment, just walk in and get a tour. And there are pros and cons to that. If you do just walk in, you will get a tour, but if you call ahead and schedule the time actually with the admission director or with the person that's going to be giving you your tour, you can be assured you're going to get quality time. They're going to have enough time put aside for you to take that time and ask all the questions and answer all the questions that you have. So if you want to do that first, and I always encourage a second time, maybe pop in on a different shift and take a look around, but make sure you give yourself that valuable time where you have one-on-one. The staff interaction, I find the most interesting, because when you see the staff interacting with each other and interacting with the residents, you know if it's a happy building. Staff that say hello, that they know each other. See, the staff knows residents' names, that they make sure they call the residents by Mr. or Mrs., that they're showing respect, that they know each resident, that they know residents' families. That shows that your staff is involved. That's a care. See what the residents look like. Are they clean, dressed, accessorized? Everyone's happy? Are call bells being answered? If you're walking by and a resident asks for help, you want to make sure that resident gets help. No one walks by. You want to help everybody. I can't say more than enough, though. You're going to have a lot of questions. If it's your first tour, if it's your first time in a building, make sure you take that time. Try to put aside an hour or 90 minutes to meet with someone and ask these questions. And sit down and talk and tour and look around. I know I went over this in the beginning, but you don't want to have to choose a facility in an emergency, ever. In this area, there are a lot of facilities. Actually, in Connecticut, there are so many. And everyone has a waiting list. So you want to be put on several waiting lists. Every facility has to have a waiting list. So you can get mom or dad's name on 10 waiting lists. That's absolutely fine. Always have a backup plan. Have a backup plan. What are you going to need to do these waiting list applications? Most importantly, as far as mom and dad goes, you're absolutely going to need their insurance information. Insurance, copies of cards, copies of insurance cards, long-term care policies. And in order to get on the waiting list, you have to fill these applications out completely and return them. And most importantly, you have to sign them. An application, when it's brought back, if it's not signed, and a lot of folks sometimes are a little bit leery and they don't want to sign it, you're signing that the information that you have provided is correct. But if it's not signed, it's not considered a complete application, and a lot of places will bump it right back to you, and it'll take that much longer to get on the waiting list and to get a waiting list number. So once you return that application, you should get a phone call or a letter and you're assigned a waiting list number. There are exceptions to the waiting list, because if there's 100 people on the waiting list, how long do I have to wait? Well, there are exceptions. If dad already lives in the facility and mom is ready to come in, mom can bump the list. If there's a spouse already living in the facility, then the other spouse can jump the list and can be the next admission in. A private pay admission can always bump any other admission. And if we have someone who's recently discharged from our facility and within 30 days has found themselves back in the hospital or at home in crisis and in need of placement again, we can take that person back ahead of anyone else on the waiting list. What you're going to get, and once a year I send these letters out, waiting list letters out, and I get these phone calls from folks, and it's, they get real nervous because it says, do you want to remain on the waiting list? And that's a waiting list law. I have to send these letters out just asking you again, are you sure you want to stay on the list? Then you have a 30-day window to check yes and send it back to me. If we don't hear from you in 30 days, we do have the right to remove your name from the list. I personally always follow up with a call if I haven't heard from you because we're busy. And I know it's hard and it may be put aside and you may not think about it. I also include my email, so if you don't have time to call or put a stamp on it or whatever, shoot me an email and say, I want to stay on the list, that's fine. I'll print it, I keep it in the file, and you're good. You can say, if I call you and I say to you, you know what, I have a room and it's the perfect room for mom, and are you ready? You may not be ready. Maybe mom's not ready to come in now. She's doing great, she has a caregiver at home, and she's doing activities, I think she's doing fine. I'll go to the next person on the list, and they will get the bed. But the next bed that opens, I'm going to call you first again. It may be a couple months, it may be a day, it could be 6 months, but you'll get the next call. You're still my first one on the list, and you have the right of first refusal. So I never feel pressured. Like if you say no, it's like I'm going to go back to the bottom. You stay on the top. We only have one list. There used to be a short-term list and a long-term list. Now there's only one list. The one list is for long-term care. Our short-stay care, our post-acute care is on a first-come, first-served basis. So when you pre-book, if you have someone that is having surgery and you know that you need to pre-book for post-acute care, we do as best as we can to take the pre-books in order and admit in order. It doesn't guarantee a bed, so in that case, if you're looking for someone needing a joint or coming post-surgical care, have a backup. I can't always guarantee there'll be a bed for that. If you pre-book, I do the best I can to keep that bed open for you, but always have a backup. But for the long-term care, there's only one list. I know it's hard because a lot of folks have their heart set on their first choice. And it can be difficult to know that you're not always going to get into your first choice right away. And if you do have a backup plan, and you go to your backup plan, know that you can always remain on the other list until something opens up. Folks can transfer. And as far as us at McLean, we're always here and we're ready to help you, to answer the questions, to find the right place, to find the right spot, and to find what's going to fit best for you and your family. Fortunately, we have all these different levels of care, so we can help you find the right spot. Okay, a couple questions. So the typical staff, what is a typical staff resident ratio? We have approximately, on our post-acute unit, I can tell you 30 residents. We have 2 nurses for that unit. And our staff usually will have 7 or 8 residents. Varies by acuity. Most units will vary by acuity. If the assignment is a heavy assignment, we try to make it less an assignment so that those aides and those caregivers can give the best care to that number of people. Because if it's a lighter assignment, you can take on a couple more folks. So we are able to do that, and we're also very fortunate to have long-term staff that have been there forever, that are the family of these residents, so they keep steady assignments because these residents have become their family. The application process for short-term and long-term, so you're going to call me, or you can go online, or whatever it takes, and you give me a call, and I will send you an application. You don't always have to come in. I'll mail it to you. I can email it to you, whatever's best. You fill it out, sign it, get it back to me. Keep a copy for yourself, though. That's always important. You keep a copy for you, because I'll send you a letter back with a waiting list number on it. You want it to be complete. If you're applying for our long-term care or for assisted living, you're also going to receive a financial packet too. And that also needs to be done completely. There are instructions on it, so we do need financial information on that as well. And you send that right back, and we can also email that out to you, and the girls will give you all their email numbers. A referral versus an application. I get many what I call inquiries. Many folks calling and asking, and that's an inquiry. You're not considered on the list, you're not considered officially on the list until I have an application back. So a lot of folks ask questions, but that doesn't reserve you a spot until there's an application back, and then you are in line for a bed. And you always have the right to refuse. How do I get a private room? If we have a private room open and we know that it's somebody that needs it for either behavior, medically, or if it's something they prefer, we always try to give it to folks, always. Some folks are social, they don't want a private room. We are very fortunate. We have a room called a suite, which is 2 rooms, 2 separate rooms that just share a bathroom, which is a great, great setup for a lot of my social ladies, because they have their privacy and just one shared bathroom. So this is a great situation where it is almost private. But our private rooms are first come, first serve, or if it is a medical need. My waiting list right now for long-term, I do have quite a few folks on it. I'm going to say maybe about a 2-year wait right now. You should always have that place in line. You should get a receipt, a phone call, a letter, something with your number on it. And it will be your inquiry list number and your waiting list number. And that's your receipt of where you are in line. So you actually could call and read that number back, and that should tell you where you are on the waiting list.
So when you have your...
No, I have it in order. My waiting list is in order, but I go right down. I just do it alphabetically, and I send letters out to everybody on my list, and then they come back, and I just go through who might want to be taken off. But my list is in order, so if a bed opens, I start right at the top, whether it's a male or female or private or whatever, and I go down that way. I have some folks, and I love it, that have been on the list since 1994, and I call them because I may not hear back from them in the 30 days, and they still want to be on the list. Not ready yet. They still want to be on the list, and it's the same fellow I call all the time. And we're getting to be so close. Well, thank you for having me.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.